So I'm so glad that today we're able to officially announce that the federal government and the government of British Columbia have reached an agreement in principle that moves us forward on healthcare. Thank you, David. In fact, I can actually add one more to the list today. We now have a signed agreement with Saskatchewan as well. We're glad to have them take the step with us and be part of improving our healthcare systems across the country from coast to coast to coast. Both provinces will join the 7 others that have already signed on in creating 3-year action plans that map out exactly how they will use these funds to make the improvements that Canadians are counting on. Each agreement will be tailored and flexible to the needs of each province and territory, but consistent among all is the joint responsibility to collect information that monitors how the healthcare system is performing so we know that it is delivering the improvements that Canadians deserve. Things like the percentage of Canadians who have access to a family doctor or nurse practitioner and tracking to make sure that that percentage keeps increasing. Or how long wait lists for appointments and surgeries are and whether they're decreasing. More access to mental health care and substance use care, which I know is a shared priority with our partners here in BC, where you're all on the front lines of the opioid epidemic, and moving towards a more modern system that allows for you to securely share your health information with your entire healthcare team. We're doing this because what gets measured gets done. Another element of our plan is asking provinces and territories to improve how we recognize foreign credentials for health professionals so that it's easier for nurses like the ones I met here at KPU Langley to get their careers started, treat patients, and be part of easing the pressure on our overworked healthcare professionals. We're also committing $2 billion for an Indigenous Health Equity Fund to support First Nations, Inuit, and Métis partners in closing healthcare gaps.
I know, like the Prime Minister does, these past few years have been incredibly difficult for healthcare workers, and it's been hard on British Columbians too. The pandemic, combined with the rapid growth in population here in British Columbia, record-setting growth, has meant that too many British Columbians looking for a family doctor can't find one. Concerned that if they get sick, they go to hospital, they may not get the care that they need. Some people out there say that the answer to our problems lie in privatized healthcare. That if people could buy their way to the front of the line, that somehow the line would go away. Or if we pulled doctors and nurses and health professionals out of our public system into a parallel private system, somehow that would improve care for everybody. It doesn't shorten the line, it just changes who's at front, and it puts added strain on our public healthcare system. That's not the direction we're going, and it will not be under my leadership.